Back on Module 5, this is Part 2, and it's reviewing the urinary system. The objectives will be to identify the functions of the urinary system, discuss reasons why a person may be on a fluid restriction, and identify normal urine characteristics to report to the supervisor. Let's discuss some basic anatomy of the human body. We're looking at a female and a male urinary system. The urinary system consists of 2 kidneys, 2 ureters, a urinary bladder, a tube called the urethra, and a meatus. The urethra may play a role in why females are more often the ones that get urinary tract infections. Any potential infectious bacteria entering the urethra has a much shorter distance to travel in females before it reaches the bladder, thus causing the more frequent infections. Review of the function of each of those urinary body parts. Kidneys clean and filter waste products and toxic materials from the blood. The substances such as the waste products and toxins that the body does not want reabsorbed stay in the kidney and form urine. Ureters are the tubes that connect the kidneys to the bladder. They are about 1 foot long. When a person urinates, the ureters will prevent the backflow of urine into the kidneys. The bladder temporarily stores urine. Once the bladder collects about 200 to 400 milliliters of urine, an impulse is sent from the spinal cord and initiates the bladder to contract. The urethra is the tube that allows the flow of urine from the bladder to exit the body through the outer urinary opening, which we call the meatus. Here are the functions of the urinary system. Our urinary system filters and eliminates waste products from the blood. 1 kidney is capable of this, and so some people are able to live normally with just 1 kidney. The kidneys help regulate the water balance in our bodies. This is called homeostasis. Electrolytes are chemicals that are important for the cells in the body to function and allow the body to work. Examples of electrolytes are potassium, sodium, and calcium. Our kidneys also aid in regulating our blood pressure by allowing a certain chemical or electrolytes in our body to either remain or to exit our body through the urinary tract. Some normal changes that adults may see as they age. The kidneys become less efficient in filtering blood. The bladder tone weakens, causing some periods of urinary incontinence, which means the person wets themselves. As we age, our bladder may hold less urine than before, and the bladder is emptied. This would indicate more frequent need for toileting, including during the night. Some individuals may find that their bladders do not empty out as they should. Older men with enlarged prostate glands may have this problem, especially, which can lead them to having urinary tract infections. Normal characteristics of urine are the following. I told you before it should be light, pale yellow. Slightly amber is a term we use. It should be amber in color and clear. Imagine looking through a clear cup filled with Mountain Dew. You should be able to see right through it. That's the same with normal urine. All urine has an odor, but it should not be offensive or too strong. On average, adults should have an output between 1,200 to 1,500 milliliters of urine every 24 hours. Some elderly will produce less. Here are some characteristics of abnormal urinary symptoms that would need to be reported to the supervisor or nurse. Cloudy urine could mean several things. Urine can become cloudy as it stands, but it is cloudy after being freshly voided. That means it's infected. Dark or rust-colored urine may indicate the presence of blood or that the person is not consuming enough fluids. Strong and offensive urine could be from lack of fluid consumption or a potential infection. If the urine smells sweet or fruity, that's a sign of sugar from diabetes. Pain with urination or burning, pressure, as well as periods of urinary incontinence may also be signs of an infection. A fluid restriction is the limiting of fluids consumed in 24 hours. Reasons for a fluid restriction could be due to cardiac problems, known as heart problems. The heart may be having difficulty in circulating blood properly, allowing for increased swelling in extremities or extra fluid in the lungs. Renal disorders are kidney disorders. Remember, the kidneys have the ability to keep fluids from leaving the body. Other reasons for a fluid restriction would be from a brain tumor, trauma, and potential liver problems. Normally, a doctor will give the order to restrict fluids and foods that are considered liquid, such as Jell-O and ice cream. The order could read 1,500 milliliters of fluid per day, for example. Follow the supervisor's direction on the amount of fluid that the resident can consume at meals and in between meals. We are to encourage the resident to follow orders, but we cannot force them to abide to them. Notify the supervisor if the resident is not compliant. Your responsibility as a nurse aide working with a resident on a fluid restriction is to make sure that you are following what you have been instructed to do. Do not sneak extra fluids nor deprive the resident of what fluids they can have. Measure the fluid accurately, as every milliliter counts. Encourage the resident to consume all of the fluids they are allowed, and after they have consumed the liquids, accurately record that amount where you have been instructed. An accurate output amount will also need to be recorded. NPO, once again, is nothing by mouth. This means no food nor water until the doctor says it's okay. Some residents may become unhappy and irritable if unable to consume anything, especially if it's more than 12 hours. Most often, residents become NPO because they are fasting for blood labs to be drawn or they are going to have a procedure done. Other reasons can include having extreme nausea and vomiting or having a difficult time swallowing. This concludes this section of Module 5.